On September 15th, Wisconsin Governor Tony Evers signed an executive order to ensure access to vaccines in Wisconsin. The order directs the State Department of Health Services to take every action available to make sure vaccines, including the COVID vaccine, are available. He directs a whole-of-government response to combat recent federal actions, which he says undermines medical professionals. The order asks the State Department of Health Services to work with other state agencies to remove barriers to vaccines, and it directs the Office of the Commissioner of Insurance to work with health plans. It was just at the end of August that the FDA approved updated COVID vaccines for the fall 2025 season, but limited who can get the shots to largely those age 65 and older, limiting access for millions of Americans who may wish to get vaccinated and may find they no longer qualify for a shot. The CDC's advisory committee still needs to vote to recommend vaccines, which could pose more barriers to access. In the Wisconsin executive order, the governor directs the Department of Health Services to continually monitor and review immunization recommendations, issue guidance on the COVID vaccine, determine whether any additional measures may be necessary to provide clarity and guidance on other routine vaccines, and directs the chief medical officer to issue a standing order to allow and enable Wisconsinites to get a vaccine at a local pharmacy where appropriate. It makes some direction for the Office of the Commissioner of Insurance as well to collaborate with health plans on way to ensure their insured are informed with accurate, up-to-date information about access to vaccines and limiting the cost of vaccines, and direct all health insurers within their regulatory authority to provide coverage for COVID vaccines without cost sharing to all of their insured. In a statement, Governor Evers said, "Vaccines save lives, folks. Spreading fear, distrust, and disinformation about safe and effective vaccines isn't just reckless, it's dangerous." He continues, "Here in Wisconsin, we will continue to follow the science to ensure Wisconsinites have access to the health care they need when and where they need it, and to make their own healthcare decisions that are right for them." You can read the executive order. We link to it in the description below.